You've heard about it on the internet, you've probably seen it in the news, or you've probably heard it on the radio. What am I talking about? I'm talking about the swine flu. Today I'm going to talk about the swine flu, and I'm going to talk about how the disease is prevented, how we can treat it, what the signs and symptoms are, and how it is transmitted. But first let's take a look on what the swine flu really is. The swine flu is a respiratory disease commonly seen in pigs. It is caused by the A influenza type A strand, which is a virus that causes high illness rates and low death rates among people. Unlike other flu-like viruses that target young or elderly individuals, this virus actually is commonly seen in individuals between the ages of 20 and 45. Usually the virus has outbreaks between the late fall and early winter months in correlation with the regular seasonal flu viruses that we have. The first time that the swine flu was seen in the United States was in the 1930s when a 32-year-old woman who was pregnant was hospitalized for pneumonia. She died 8 days later. Upon her death, the investigation revealed that she was infected with swine flu via an infected pig at a county fair that she attended. Also, in 1976, a Fort Dix troop was reported to his CI that he was feeling weak and tired. Not wanting to miss training for the day, he refused to seek medical attention. The next day he died, and 4 other troops that he served with were hospitalized for pneumonia as well. So now we have a brief view of what the swine flu is. Let's take a look on how it's transmitted. Swine flu is transmitted by an infected pig, which the virus then mutates and allows it to be transmitted to humans. Once the virus has been transmitted to humans, it allows for the human-human transmission, which is currently what we're seeing today. People that work with pigs and poultry are at higher risk of catching the infected virus from the pigs. With these individuals, we strive for them to practice good hygiene. In which case, prevention is the key with most viruses that we see today. So let's take a look on how we can go ahead and prevent the virus from spreading. One of the ways is when a person has a cold, we always tell them to cover their mouth or blow their nose when they have a runny nose. The keys with this are making sure that you wash your hands before and after coughing, and make sure that you pick up your trash when you sneeze. Don't lay tissues around, and make sure you practice good hygiene, good common sense. Also, another way that has been proven for the reducing of transmission of infectious viruses is also to use hand sanitizers. Hand sanitizers have been proven to work, and they're highly recommended. So if somebody has been infected with the swine flu, they can start showing symptoms about 4 to 5 days after contact. These symptoms could include fever, chills, headache, sore throat, vomiting, diarrhea, and also lack of appetite. If a person would start showing these symptoms, they usually will seek medical attention. And once they do, they would be treated by antivirals. Antivirals are medications that help lessen the symptoms of a virus. It doesn't cure it, but it helps lessen it. It also can help decrease serious complications that you could have with a virus. There are 4 medications out there, antivirals that are out there. The 2 that are drug of choice for the swine flu are Tamiflu and Relenza. To be treated with one of these 2 medications, you need to have a confirmed diagnosis. To get a confirmed diagnosis, we obtain a specimen and we send it off into the lab at the CDC, and we wait for the analysis and to confirm. Once you've been confirmed with the diagnosis of swine flu, we will go ahead and treat you with these 2 medications. In conclusion, this is just a brief background of what the swine flu is. The swine flu has infected over 787 people in 17 countries, and alone there have been over 220 individuals infected in the United States with 1 death. So please take this disease, this virus, very seriously. If you have any more questions or would like to get more information, please log on to the CDC website or the World Health Organization, other known as the WHO, to obtain more information. Thank you.